everyone, and welcome to Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir. I will be your host as we journey through this world of wellness together. I'm joined here today by Dr. Nina Mansukhani. Very honored to have her here. She's a celebrity doctor that we will be speaking to. Thank you so much for being here, Doc.
Thank you for having me. Totally my pleasure.
Thank you. Can you give us a brief of yourself, because I don't want to let everyone down by giving you a discounted profile for a potential or that we know is a celebrity doctor.
Honestly humbled. And I've been working at this beautiful place called Jahangir Hospital for the last 18 years or so. And I absolutely love what I do. And I think that should be the dictum for everyone doing anything today. And
Absolutely.
that is the sense of wellness, actually.
But what is it that you do?
So I am an obstetrician gynecologist,
Right.
and I've been here working at the department at Jahangir Hospital for the last 18 years or so. I deliver babies. I operate people who have problems with periods and everything to do with their uterus. And we also create babies because we have a lot to do with people dealing with subfertility as well.
Okay.
So, in a gist,
How many babies have you delivered?
well, it's difficult to count, but I think maybe 3,500 plus.
Wow.
But that's an arbitrary number, but I can't tell you really more than that.
No, the reason I say a celebrity because you have a big social media presence and following, so really people love your content and
Yeah, I really love the fact that doctors can use social media to interact with their clients, because you got to put it out there correctly. There's such a lot of misinformation.
absolutely.
And especially to do with wellness, dietetics, nutrition. I think it's really important for people to follow correct advice.
Yeah, absolutely.
So important.
So let's start by asking you, what does wellness mean to you then?
Well, yes, wellness to me means the absence of disease
Okay.
and the feeling of happiness in what one is doing in the day-to-day life, a sense of well-being, emotionally, mentally, physically,
Mm-hmm.
and that's
Okay.
it.
Well, all the guests that I've been talking to over these last few episodes and will be talking to in the future, we've all been talking about wellness and, of course, the, at least as you said, the absence of illness and things like that, and what we can do to prevent that. Here, our discussion is slightly different because we're actually talking about things that we want to induce, not prevent in some cases. So it's a unique discussion in that sense. We want to get people to have more babies if that's what they want to do, at least.
Yeah.
So, what are the challenges that young couples face today in terms of conceiving children?
I think time is the biggest challenge, honestly, because with the totally imbalanced work-life balances where there's too much time given to the workplace and there's less time for intimacy. I think the biggest challenge people today are facing is actually creating babies successfully, because you have only once a month to do that, and if you
Right.
lose that time, you've lost it. And that is what is happening in the IT, that's happening in the corporate workplaces a lot.
Mm.
The second challenge I think they're facing is the age, because we don't realize as the age is advancing, everyone's focusing on their careers, and their career goals come first. By the time they really want to conceive, they're 35 plus. In fact, the equation has changed so much after COVID,
Right.
because a lot of people have delayed pregnancies during COVID, and everyone now is 35, 37 plus, and they don't realize then that they're
Everyone talks about this biological clock and
clock.
things like that. Is
The
that a
egg
myth?
reserve.
Is there truth to that? What is
It's
the
very, very true, and
Okay.
especially so for Indian women, because Indian women actually lose their eggs much faster, and we reach menopause much faster. So I think it has to be a balance of both. It has to be a balance of your career plus your family, and it's called as planned parenthood.
Yeah.
You actually plan it in a way that, okay, if this comes first, this also must come in.
Right. So these these are the you're saying, so work life balance is one of the biggest challenges young couples are facing. How do we try and deal with something like that? Because it's a part of life. How do you not go to work and things like that? So
I think it's very important to be in the correct mental, physical, emotional readiness for planning your family and your pregnancy.
right,
So it's very important then to seek advice at the right time. Maybe seek counselors' help and therapists' help, like we have here at the Wellness Center. And you could see them and seek advice on how ready or not you are, and what can you do about it, and see fertility experts at the right time, so that you're not delaying it too much. I know a lot of people coming and asking for, I want to know what my fertility count is. So, people are aware, people are getting aware of this. And it's important then to know how much to plan and when to plan. And of course, doing, probably if you enjoy what you do, you won't feel that you worked at all. So that's one way I'd say, that just select what you love doing, and
right.
then you're spending a large part of your day in that place.
Absolutely,
So you have to be happy doing that. When you come back home, you're not going to be tired
in a
and fed up. And you're
great
going
state
to
of
be
being in your head,
good
in your
state.
mind. Yeah. Which comes to the other thing, how much does stress play as a factor in this?
Stress plays a huge unseen factor,
Right.
because traditionally there was a saying, yeah, you want to conceive, send them on a holiday. And that really does work. And I still tell clients, like, please, when you're actually uh, trying to make that baby, please don't have that thought in your mind that you have to conceive just then. So just have fun.
That's a great bit of advice for people who want to conceive.
Don't just put it in the
Or even
balance.
for that matter, for people who don't want to conceive.
Too much performance pressure. So
Is that something that you genuinely see?
I actually genuinely say that, and I do, because people go for monitoring, and they go for the cycle monitoring, so to say, to see whether the egg is getting ready to get out.
Yeah.
And that's when the sperm has to go and catch that egg.
Right.
And sometimes that poor sperm is not reaching where it has to reach, because it's just not shot. So
Performance anxiety, as you said.
it's true. And then the entire month gets wasted, and the poor girl has to start all over again.
My next question is, hopefully we've got to the point where someone is pregnant, and
Yeah.
there's this another myth or term thrown around that you're always eating for two.
Right.
What does that mean? Is that a myth?
That's actually a huge thing, because once a girl is pregnant, everyone thinks that, firstly, everyone thinks they are the doctor, and there's a lot of unsolicited advice. And so eat for two, because you're probably,
especially in the Indian culture,
in the
and Indian families.
culture. And eat because you're making a new life. Eat because there is a new body growing inside you. But what people don't realize is just one stomach to digest what you're eating. And that is where it's very, very important to seek correct advice from a nutritionist, see a dietitian probably in the first, second, third trimester, sort out your calorie needs. And I think Indian women have a huge challenge, because we are the diabetic capital of the world.
Yeah.
And we are also having almost a 20 to 25% incidence of diabetes in pregnancy. We're making bigger babies. And our height is not necessarily increasing, and that is where our C-section rates are going up.
Okay.
And so natural birth reduces. And
So what would be your biggest nutrition guidelines? I know they'll be fairly specific for different people and things like that, but broadly.
Broadly, the first trimester is not when you will have your cravings. You're going to be massively nauseous. Don't force yourself to eat. The second trimester is when hunger is going to kick in, the pangs are going to kick in, and
I'm always in my second trimester.
The cravings, the traditional cravings are going to kick in. Please concentrate on eating protein. That's the biggest mistake we Indians do. We concentrate a lot on carbs, and we don't go heavy on proteins. Protein is the building block. It's making a new body inside you. So protein. And the second thing is, includes reds and greens in your diet. Reds will give you all the iron that you need, extra iron. Greens also will give you the iron. And make sure you get adequate calcium.
Okay.
Don't go very heavy on calorie stuff. Seek a nutritionist who might inspire you to eat different stuff if you want the cravings to be satiated.
What about exercise?
Very important.
Oh, really?
Underrated. Very important.
Because I can imagine people being fearful of that when they're pregnant.
Yes. So a lot of people are told, rest it out. But a lot of people who want natural birth, and normal delivery, like we say here in India, we have to start exercising actively from the second trimester onwards. If you're actively exercising from the beginning, great, just continue doing what you're doing. I have a lot of women going to the gym, getting on the treadmill, people doing Pilates now in pregnancy. So I think it's great. Exercise does lead to a lot of mental wellness,
Absolutely.
increased chance of you delivering vaginally, less chance of cesarean section and operative birth, back to your feet, back to normalcy as fast as possible once you've delivered. So I think it works great.
Yeah.
It's underrated, but the best drug for natural birth
is exercise.
Yes.
And then I suppose when you link that with the right nutrition, you're already on the
It's
right
a
path.
nice.
Well, coming to a different aspect of this now, I mean, there's lots of taboo around sex and pregnancy and things like that. What are the biggest taboos that you find that people, when they come to you, they find uncomfortable to bring up, or things that you feel that need to be brought up that aren't spoken about?
Actually, I'm really glad that you brought this up, because a lot of younger people who do come to me are quite open about it, and they ask me about intimacy. And actually, when I do see them for the first time, instead of them asking me, I do volunteer the information myself, because it's not nice when they're awkward,
Right.
but it's a very important aspect of their well-being as well.
Mhm.
During the 9 months, it's important to know that you should just keep yourself away from infection, and be, of course, gentle. Like they say, a gentleman should be on his elbows. So during pregnancy, it's really important, and to make the lady in question comfortable.
Right.
And I also want to say that, the first trimester is a little dicey, especially if you had bleeding, and 25% of women do have bleeding in the first trimester. That's when you got to be a little careful. Second trimester, I think you're relatively safer. And in the last
No,
trimester,
what do you mean? You're talking about
I'm talking about sexual intimacy.
during that period?
Yes,
Okay.
during that time.
Yeah.
And in the third trimester, I really want to break this taboo, because a lot of people use sex as a method of inducing labor. And I think
There are
that's,
lots of famous
yes, that
Hollywood movies that they do that
they
kind
do
of
that
thing.
and they
So,
propagate it.
yeah.
But it's not really true, because the semen actually has very little of the chemical called as prostaglandin, which actually starts labor. And I'm a little skeptical, especially using this during the last 2-3 weeks. Sometimes you might end up with your waters breaking, and then it becomes a challenge, because you have to deliver in a
Right.
in a certain number of hours
Okay.
once you've broken your waters. So please don't use that. It's not an evidence-based practice at all. Just do it for the
It's a
fun
fun-based
element,
practice.
if you have to.
Okay.
Yeah.
Well, you can see people laughing, which is always fun. What about the other taboos that happen perhaps before pregnancy that people are uncomfortable when they come to you and asking those kind of questions?
I think a lot of it has to do with actual physical intimacy, and some people are not able to really have sex or even establish that penetrative contact that they have to
Right.
have. It's a very important part of getting pregnant. When you go to a fertility specialist, I think it's very important that the fertility specialist should even ask you what your sex life is, what your sexual frequency is, because that's how you make babies. There's no other way except in the lab.
Yeah.
So yes, a lot of people sometimes come back, and I've had people who've been in a marriage for 3 years, 5 years, and still not able to do it. So you got to actually break it down for them, sit them down, and break it into the emotional aspect of it, mental aspect of it, and then actually the physical aspect of it. And if there are physical barriers to it, there are things that we do, like surgeries, teeny weeny things that one can resort to make it okay.
Okay. And then coming to the mental health aspect, how can that be incorporated to, as I said, make this more inducive for either pregnancy or during the pregnancy?
I think mental health is really, really important in our country, because it's huge. It's a huge taboo. People don't want to talk about it, and PPD, or postpartum depression,
Right. Oh,
is
that's the other
real.
aspect. Yeah.
Is real. We've seen people running out of their homes during pregnancy. We've seen people running out of the ward, and psychosis is huge. So I think it's very important to sensitize the family around the girl in question when she's pregnant, and look for certain signs. There are basic things like the Edinburgh mental health scale. You can just sensitize the family to know that, okay, these are the signs that you should look for.
Right.
And if she's behaving like this, please let us resort to a simple anti-anxiety. Unfortunately, saying antidepressive pill really has a taboo attached to it. So it's rather easier to say anti-anxiety pill and give that. There are lots of safe medications that can be given antenatally during the pregnancy and postpartum. Never leave a girl alone postpartum when she's having these issues. And
what percentage of people end up?
Sorry?
What percentage of women end up having this kind of condition?
I think it would be easily 20 to 30%.
Okay.
And keep a birth squad around her, keep a good support system around her. Simple stuff that can be done by the families and talk about it. I think it's important talking, refer them to mental health practitioners.
Right.
A psychiatrist is not a psychologist, and a psychologist is not a psychiatrist.
Right.
A psychologist is a guy or a girl who's just going to talk to you. That's it. And it's very important to say he's not going to give you medication.
Yeah.
He's going to work you through behavioral changes.
Right.
That difference has to be brought out.
Okay.
So,
well, final question then, Doc. What are the biggest takeaways that you would give a young couple who are trying to get pregnant?
Okay, no stress is the first. Second,
which is yeah, I would agree. Perhaps easier said than done, but this is definitely something that
I
they need to
always
do.
say, you don't take the stress. We are here to take the stress. We're here
Right.
to guide you. You just do what you have to. And in the longer span of things, trying for 6 months is not a big loss. So don't keep timelines for yourself that are going to pressurize you more, because 6 months is really nothing in the long scheme of things.
Yeah.
And I always say that the worst case scenario, there are very few people who actually don't conceive. The worst case scenario is that you will reach IVF or ICSI, when that is the worst case scenario that you'll reach. It's not that you're not going to get pregnant.
Right.
And so don't create pressures around yourself.
There are lots of options
unnecessarily.
today.
There are lots of options.
Right.
And be happy creating babies, not stressed out.
Well, keep posting your reels on Instagram, and I'm sure. What is your Instagram handle that people can start following you
It's
on?
just Dr. Nina Mansukhani. It's Nina Mansukhani. It started out as a very private account, and then patients started following
Well,
me.
now you have thousands and thousands of followers.
Well, just a few. I don't know. I'm a nano influencer, so to say. But I'm
well,
really
that's
glad.
good, because babies are nano. So
Just happy to connect with people on a one-on-one and get the right information.
well, thank you so much. It was very
Thank
lovely
you for
connecting with you,
having me.
Dr.
Thank you.
Nina. Thank you so much for
Lovely
being
being
here,
here.
and we look forward to joining for the next episode. So thank you.